Joining us now is Rob Hamilton. Rob is the Chief Executive Officer, CEO of MedTrans. Rob, great to have you with us, man.
Hey, good morning. It's great to be with you.
Hey, Rob, I really wanted to have you on today because you're involved in one of the biggest issues in Virginia right now that's under everybody's radar screen and also nationally. Can you elaborate a little bit about what you guys are focused on?
Yeah, so we're doing a lot of work today, as you mentioned, with congressional leaders in D.C., primarily around the surprise bill legislation that's out there. At the end of the day, we're working with them to try to make sure that access to air medical services remain in the Commonwealth and across the U.S.
What are some of the biggest obstacles right now that you're facing, Rob?
Well, the biggest obstacles we're facing is, healthcare is a complicated issue, and Congress is working with us to try to remove the patient from being stuck in the middle. A lot of the commercial insurance providers today are really creating a disincentive for working with out-of-network providers and trying to negotiate in-network rates. And Congress and surprise billings is, broadly complicated, but something we're working with them on trying to find a solution for.
You're an experienced executive in this business. You've had almost 30 years in the healthcare industry. You're with the MedTrans Corporation since 2010. Right now, you're ahead of the organization. President Trump and the Trump administration has really tried to focus on getting rid of this surprise billing thing. This is something that everybody can agree with. It drives them nuts. I mean, you go into the hospital, you have a procedure. I mean, I just had one, I think 18 months ago, a simple thing. I had a colonoscopy, right? At my age, you have to get those. Rob, yep. No big deal. You get it. It's covered. I had a couple of polyps, right, that they had to look at. And they said, yeah, no problem. Anyway, 2 months go by. I get a bill in the mail. It was like $2,900. Said that's called surprise billing. I'm like, what the hell is this? Now I had no idea what this was. Go back to the insurance. That's not covered under the deductible. I don't know what it was. All I know is I got stuck arguing with them for 10 months, and then you have to pay it. So nobody told me ahead of time what this were. I had no options. You just go in. It's done. How do you stop this from happening? Because this is driving people nuts.
Well, like I mentioned, I mean, it's a complicated issue, and your situation's not unlike many others. You pay into insurance, commercial insurance for years and years and years while you're working, and you don't really think about what's covered and what's not covered. So that's one of the reasons why we're really working to try to have good policy debate on a solution for the surprise billing problem, to make sure that we're clearly having transparency discussions and sharing data back and forth. But your situation is not any different than a lot of other people, where you walk into the hospital thinking you're going to have this procedure done, and you get stuck with more than your deductible as a payment.
Well, Rob, another angle is the Trump administration is trying to work with Congress, because all bets are off now with the stupid impeachment inquiry they have to waste our time. Instead of dealing with something that matters, like surprise billing, politically, just sidebar, Rob, I don't know what the Democrats think they're going to run on in 2020, and I know you're nonpartisan, you're CEO of a company, but I'm telling you, I have no earthly idea what their campaign what their message is going to be, trying to get power back or maintain it when they've done absolutely nothing but investigate Trump. It's a complete joke. But we're talking about settling payment disputes between insurance and providers, and the Trump administration has been very adamant about this. Democrats are pushing for kind of a one-size-fits-all scale that rate set prices. The problem with that is you get into rationing with that. So that doesn't make any sense. This means that when doctors visit costs in New York City are going to apply to, say, the same standards would apply to Richmond or Roanoke or Tri-Cities or something. What's the plan for negotiating this? Because, like, if you take my example, I got a $2,900 bill. I had no ability to negotiate with anybody.
Yeah, well, again, the issue is incredibly complex. These air medical transports in our industry are ordered by medical professionals. Oftentimes, we run into not only patients and the balances, but just refusal to cover medically necessary flights. I mean, the air transport providers in the U.S. are being activated by physicians. They're being activated by professional EMS, fire, police, rescue folks from the scene. So they're not even on the front end of the call. And this is a big issue for us going in.
So let's get to the emergency air transportation. So health insurance companies, they want to get out of paying any medical bill related to emergency air medical transportation. So let's just give an example, right? So, someone drowning in the ocean, they get rescued by a helicopter. They get airlifted from a car wreck, say, going on 95. And then they got to drive. They got to get 2 hours to a trauma hospital. They need an airlift for that. So why shouldn't insurance companies be absolved of paying for that?
Your point's great, and having grown up in the Commonwealth, I can relate to the terrain and the traffic in Northern Virginia, Richmond. But today 1 in 4 Americans live greater than an hour from a level 1, level 2 trauma center or stroke center, cardiac center. So that's why these services are so critical. Now, because we've really worked to get air medical into the rural parts of the U.S., 90% of Americans can reach these specialty centers within an hour that help us optimize good patient outcomes.
So Rob, what is if you take your company Medtrans, what is Medtrans' position here on surprise billing? Like, what is the best way? Everybody hates it.
Yep.
The Trump administration has prioritized it. It's one of those things. No one can argue this, right? No one wants to go get a procedure done. It's already done. You have to have it. It's done. And then you get a bill, and it's like, what the hell is this? And then you have to pay it or go in debt or, they go and they get a judgment on your family. I mean, this is what people are dealing with. This is reality. What is the plan to deal with this? What do you think is the best way to deal with it?
Well, first of all, too, let me tell you on the air medical side of things, 7 out of 10 folks that we fly are covered by Medicare, Medicaid. Medicare, Medicaid traditionally reimburse at greater than 50% of the true cost to provide the service, so that's a problem in and of itself. But your question was, what's our solution? And I think we can continue to work with congressional leaders to make sure that access to emergency air services remain. There's a congressional push with the language now working through Congress to try to get patients from being in the middle on this issue, and we support that. We also support the need for greater transparency and data exchange between the insurers and the air medical companies. That's the only way that we're going to actually understand what's driving cost and the true value that the air medical services are providing. So without that, to your point earlier, setting a median rate just really drives a disincentive for insurance companies to work with air medical companies that may be out of network. Setting a rate eliminates the need for them to either have a conversation with us to get to a true in-network rate that is sustainable, or it creates a disincentive to allow what we have already worked hard to get in-network rates on to just sunset. And then at the end of the contract period, they're no longer incentivized to keep us in network. So I think what we're having conversation-wise with congressional leaders right now remains our focus. Get the patient out of the middle, support the exchange of transparency and data. And I think those things will allow us to align on a good policy decision and good outcome for patients.
You're on the John Fredericks Radio Network. You're Godzilla of the Truth in America. We're with Rob Hamilton. He is CEO of a company called MedTrans, an experienced and executive, been in the healthcare industry for 3 decades. So, Rob, is there specific legislation right now that someone is carrying in the House or the Senate that you're looking at and saying, okay, that's about as close as anything that makes sense that we're going to get, or something that you would back? Is there anything right now that's out there that's actually written on this?
Yeah, there's a couple of things, one in the Senate and one in the House. The House bill is Congressman Pallone's Bill 3630, and then the Senate bill is the health bill, and that's Senate Bill 1895. And like I said, we're working with all congressional leaders, Senate and House, providing them what we think are the right policy solutions to drive to a reasonable resolution on either one of these two bills, to get them written in the right way to, continue to allow access to remain in these rural communities. Have
you engaged the Trump administration?
We've got a great group in D.C. working with a lot of the administration folks on the executive branch and certainly on the legislative branch, where we're working with congressional leaders in all the states that we're in today. So there's a real big initiative on the medical industry to try to get to a good outcome here.
Let me ask you something, Rob Hamilton. I want you to do us a favor. I want you to put this into layman's terms, right? I'm driving to work right now. I'm driving to the shipyard. I'm a welder, right? What does this mean for me? Just explain what this legislation means to me. As I got a family of 4. I'm at the shipyard, or I'm in Southwest Virginia, and I'm driving to one of the coal mines to go to work, or I'm with Dominion Energy and I have a job there on the power lines. What does this mean to me?
Well, I think what it means to you is, to your point, surprise billing is a huge issue for patients. It's a huge issue for the administration. So we're all trying to be focused on making sure that, like you and your procedure a little while ago, or a worker in any category, that you're not, getting surprised with something that's out of network, or that you're not clearly understanding what your insurance covers or doesn't cover. And I think making sure that we do that in the right way will ensure that if you're driving to work and you have an accident, that there is a reliable air medical resource that can come pick you up at the side of the road, or if you get taken to a clinic and you need to be transferred for higher care, that same air ambulance is available to access you in that clinic and get you to tertiary care. So I think in layman's terms, what we're trying to do is we're trying to provide a solution that can be legislated to have a solution that prevents that patient from having that bad experience.
Rob, in your judgment, what entity is driving up the cost and is in favor of maintaining the surprise billing status quo? What entity benefits from the status quo?
Well, I don't know that anybody really truly benefits from the status quo. I think we all realize that this is a significant issue. And no matter whether you're a provider of the service or you're, an insurance provider paying for the service to a provider, I think we all realize the importance of getting to a good solution here. I think because we don't have that exchange of data, right now the conversations are really challenging with commercial insurance providers to understand the true value that these aeromedical resources provide to the communities. If you take it to another step and just look at the impact of rural health care, in the Commonwealth or across the nation, 20% of our rural health care facilities remain under a high risk for imminent closure. So not only do we have potential issue on the availability of aeromedical resources, but we're also seeing the continued closure of rural healthcare facilities. So it's a big, complex problem that needs big, complex solutions.
So what is the agenda for the little guy? I guess that's what I want to end this with. For the working class American, what type of a solution, if you're driving to work right now, would you say, yeah, that's about me. That's in my best interest. Not the insurance companies, not the political lobbyists, not the hospitals. But what's the best solution for the working men and women of the United States?
So what I would tell working men and women, and what I would say if I was in a town hall type atmosphere, is there has to be a solution that allows for this transparency and data exchange. So we've got to get to a point where insurance companies recognize the importance of the service, and we can exchange information. We can't just arbitrarily set a rate and think that that'll be, the end all to this. So we've got to push for Congress to draft legislation that allows for us to have a robust exchange of data and transparency, so everybody understands what we're doing.
I just think if you go to the doctor and you have a procedure, people want to know what it's going to cost. It just boils down to that. And when you talk about surprise billing, you always get the feeling that there's some nefarious, dark relationship between your insurance company, the one that did the medical procedure, the hospital. At the end of the day, we get screwed, right? Whosever fault it is, they're getting the money. We have to pay them. We didn't know what it was. And I think what people are looking for is common sense. Give me a common sense solution so that as somebody going through this, that I'm not going to open the mailbox one day and see that I've got a $3,500 or $5,000 procedure bill, of which I've got no ability to pay for, that then hurts my credit, puts me in debt. What these providers do is they'll go get a judgment. You got to show up, take a day off from work. This is a nightmare for people. This is an absolute nightmare. And I tell you, Rob, instead of sitting around and doing impeachment inquiries or whatever the hell they're doing, this should be a number one issue where Republicans, Democrats, and the Trump administration should work together in order to get this done. That is my thing here, because no one wants this, and yet there is inertia. We can't get anything done, and it's very frustrating. So how do we put a firecracker under these people?
I completely agree with you, John. And to your point, this is never a better time for individuals to be reaching out to their congressional leaders to say exactly what you just said. This is an important issue for me every single day, so that my life and my livelihood isn't impacted by an unforeseen emergency or procedure or something like that. Especially if I've been paying into health care.
Exactly.
I should be reassured that this is available to me.
Exactly.
All the time.
Yeah. You pay into the system. You finally get a procedure. They don't tell you the cost on the back end. You have to get it done. You get a surprise bill. It's not covered. You fight with insurance. That goes nowhere. The medical provider that has the bill, they turn it over to their lawyers. They go to court. They get a judgment. You have to take off for work. You fight the judgment. You can't defend it. You don't have the information. You don't have money for a lawyer. They get a judgment. They garnish your wages, and they hurt your credit. That's what's happening to everyday Americans, while Congress is sitting around with their thumb up their butt, worrying about a subpoena for the Attorney General. What a joke.
It can't agree with you more. This is an important issue that needs voices. We need the everyday man and woman to be communicating, for sure. We got to get this fixed.
And it's got a simple title, right? Stop surprise billing. Who the hell is in favor of surprise billing? Nobody, except those that reap the benefit, which are the insurance companies who don't pay it and the providers that charge it. They're the ones, and the lawyers that do the suits to get the money. Those are the winners. Working people losers. Again, seems to be the trend here in Congress, and I'm sick of it. So let's get to our congressman. Let's get Abigail Spanberger on and say, Abigail, why, you're wasting time with op-eds in the Washington Post on impeachment. Why don't you do something with USMCA, surprise billing, et cetera? No. Let's spend the next 18 months on a bogus impeachment. What a joke. Thanks, Rob. You fired me up.
Enjoy your new station there in Richmond.
All right, Rob.
Thanks for
Rob
having me on,
Hamilton. Thank you. Surprise billing. So another thing, where the hell is Congress here? Democrats, Republicans, isn't this what you're supposed to do? Fix this stuff that screws working people? Nah, they'd rather do impeachment. Unbelievable.